in public comment. Thank you for that. Next slide. As I said at the beginning of the meeting, we're the Massachusetts Developmental Disabilities Council. This picture is us at a conference of our parent body, the National Association of Councils on Developmental Disabilities. Can you go to the next slide? And our mission is to provide opportunities for individuals with developmental disabilities and families to enhance independence, productivity, and inclusion. Next slide. And we were created by the Disabilities Assistance and Bill of Rights Act of 2000, and we're part of what's called a DD, Developmental Disabilities Network, that includes protection advocacy organizations, PNA for short. Those are basically legal for legal advice and legal protection. UCEDS, University Centers on Excellence in Developmental Disabilities, which does research and training, and of course, us, a DD Council. And we're located in every state and territory. Next slide. And this is our policy team, and we have 2 new members. I would like them to introduce themselves first.
I can start. Hi, everyone. My name is Destiny Maxim. I am now the policy coordinator here at MDDC. I'm a wheelchair user myself and really value connecting lived experience with policy. Nice to meet you.
Thank you.
And I'm Rick Glassman. I think I know most of the folks from looking at the participant list, and happy to be here. I retired in January of 2025 from a long time at the Disability Law Center and have been doing pro bono work since, and have now taken on a small part-time role at MDDC, 5 hours a week, helping with legal and policy issues, and looking forward to working with all of you.
Thank you. And of course, I'm Jossie Burke-Zabit. I'm the policy chair, and I'll let Jennifer and Caitlin introduce themselves.
I'm Caitlin. I'm a policy research associate. I'll be dropping some links in the chat today.
Hi, everybody. Jennifer Bertrand, MDDC Deputy Director, also a parent.
Next slide. Now it's time for legislative updates, and I'll pass the mic to Jennifer.
Couple of very high-level slides to share with you, and then Rick will have some legislative disability policy slides that he prepared as well. We have about 2 months to finalize bills during this legislative session, and of course, the state budget is still a very much a key focus in the Senate. We'll talk a little bit more about that in a moment, and the formal session closes at the end of July. At this point, all of our priority and endorsed legislation has had a hearing. Most bills received favorable committee report. Some bill reporting dates have been extended even into June, to June 15th. This first box right here will take you to a page that talks about what are some Massachusetts legislator session deadlines and significant dates that you might want to be aware of. They've got a lot of them there, so that's what this first box is if you have more interest in that. We have had 2 policies that have been signed into law, one around education access that was rolled into a law signed by the governor, and of course the historical records. In the box in the lower right-hand corner, this will take you to the MDDC website homepage, and then the middle link will take you to the Council's disability policy resources. We've put together a library of spotlights and fact sheets and different resources on different topics that are important to the DD community that you can use to talk with your legislators about the issues that are most near and dear to your heart and matter most. And then the bottom link here will take you to our website page, the council's website page, where you'll find our priority endorsed legislation. And on the priority side, Jackson Crilly, our colleague, has been doing the updates. So you'll have an update on the status of the bill. We also included links, like if you wanted to go back and hear the hearing for our priority and endorsed bills, you could go back and rewatch them. They're online and there are links there. Now I'm going to hand it over to Rick to give us a snapshot about the status of our priority legislation.
So, thanks, Jennifer. We're just in the process right now of taking stock of where things are at. As most of you know, we have to get the bills that we are supporting passed by the House and the Senate, one version or another, by the end of July, which is very little time. And so at this point, we're trying to take stock of what bills, of the priority bills, which bills are actually in striking distance of potentially doing that, uh, if we can help with other advocates to make that happen by educating legislators. And then there are bills that we have endorsed, some of which also, even if they're not priority measures, still warrant some effort at this point to try to get them over the finish line. So if we have time, we'll talk about those as well. But let's start with the priority bills. Jennifer, can you push it to the next slide? So Jennifer mentioned House 650 relating to public education, which is passed. So that's in the win column. And then there are some bills that I think are better positioned in the sense that they are not stuck at early stages. But that's still far from saying we can get them um, uh, past this session, but they're worth trying. So supported decision making, I think everybody knows about. Really important bill. It's been passed in proposed in many sessions, and while we continue to work on it here, many states around the country have already adopted supported decision making. There's a problem or an issue with the House version of the bill related to how IEP meetings are handled. There's efforts underway to try to change that. And we will try to get the House bill strengthened and the House and the Senate bills passed before the end of July. And obviously, that's a big coalition effort with lots of other stakeholders who share our interest in that bill. Universal changing stations is in House Ways and Means and Senate Ways and Means. And I think at this point we're trying to learn more about whether changes to that bill have placated some of the prior opposition, and we'll hopefully be able to report back on that, or maybe some of you have more information. Should we go to the next slide?
Yep.
Uh, the AHVP housing bill, we've moved to the weekly position column because I think of financial issues this session. I think it's the primary issue. Uh, and then underneath that are enhanced standards for care and state plan for healthcare providers. That's in House Ways and Means and Senate Ways and Means. And so we'll be looking at that one, try to figure out what role we can play that will be constructive. Should we move to the next slide?
Sure.
Wheelchair repair is something that Destiny and I have been working on uh, outside of our outside of the work that we just started this week at MDDC. We've been working together in other capacities on this bill. Um, and we have a strong coalition, as Destiny pointed out earlier today, and hopefully we'll make it happen, but it has not been easy. Um, and then there's some other bills that I listed. You can look at them when you look at the slides that are weekly positioned. I'm not sure we need to talk about them here. And one bill which was already reported to study. So, um, Jennifer, do you want to touch upon the bills that are, should I mention the bills that are endorsed that still may require some attention, or do we not have time for that?
It's 3:14. We have a few minutes if you want to briefly just touch on each one.
I'll at least mention a couple that I think are
Yeah.
really important. One is a bill that a number of us have worked on for uh, quite a few years now. Uh, this is House 243 and Senate 139. It's a bill to try to expand Nikki's Law, the abuse registry, to include DAHAB settings, and also to streamline functions at DPPC. Um, it's in House Ways and Means and Senate Ways and Means. And we think this is a really important bill. I was talking to counsel at DPPC earlier this afternoon, and hopefully we can play a role in trying to get that over the finish line. Um, and next is House 3655 and Senate 2565. That's the blue envelope bill that helps protect people um, who are on the autism spectrum who might be stopped by police, and helps identify if that individual wants to be identified, that they're a person with autism. It has already passed the Senate, but is stuck in House Ways and Means. And again, really important bill um, that I think merits the community's support, and really ought to pass. And maybe I'll stop. I'll stop there. Unless you want to think we should get into any others, Jennifer.
I think those are good to touch on. Maybe we
Yeah.
get through the rest of these.
Okay.
Am I on the right slide here, Rick?
Yeah, I mean the other ones, the other um yes, I think we can go through the rest of the slides if you want to, for people to see the weekly position bills. But I think they probably don't warrant a lot of discussion. If anyone has, oh, we did decide, sorry, that thank you, that discrimination in healthcare still may have some potential. So that's House 1360 and Senate 869. And so we're going to be trying to weigh in on that one as well. Uh,
Oh,
and finish for the season, census study is a House 1852, 1852, and Senate 1164. So that's in study. It's not going to happen this session. Uh, and yeah, these are two bills listed here that I think we were looking to get some more information about their procedural posture. They have both been in the Rules Committee, and I think we need to just dig in and try to find out why.
and just for everyone here who might not know what SWM, Senate Ways and Means, if it's HWM, that's House Ways and Means. These are, key committees that many bills go through. And then HCF, House Care Financing, Healthcare Financing, sorry. Did you want to add anything else to this slide, Rick?
Uh, I I I don't think so. Is there anything that you wanted to discuss, Jennifer? You'd like me to discuss?
No, I mean, I would add that for the transition planning bill, that's the turning 22 bill. We did receive outreach from multiple Senate offices asking if we could write a letter and submit it to one to Senator Lovely. I think there was one that went to Senator Comerford, and there seems to be a lot of interest. It's not that common that we receive outreach from policymakers saying, hey, we really care about this bill. Can you write a letter and share some more information with X, Y, or Z committee? So that definitely got my attention. And Senator Comerford is, one of our champions. So I was really happy to see that. And Senator Lovely was also just recognized this this year at our legislative reception. So this has been an important bill, I know, to the ARC of Massachusetts, also to us as a council, because of the stories that we hear about how broken the transition process is, how many individuals fall through those service gaps. And once the bus stops coming, they end up on the couch, and family members that might even have to consider quitting a job and maybe putting their family in a financially tight situation because their family member can't necessarily be alone. And, it's important. We've invested in our students as all these years through their public education, and they've amassed all of these skills, and it's important they can transition smoothly and continue to be productive members of our community going forward. I would say the bottom bill relative to the federal definition of developmental disability, again, for lesser known developmental disabilities that might not have a strong advocacy showing, maybe they're not as organized, they don't receive developmental services because they don't meet the more narrow eligibility criteria. I think we were talking earlier today, Rick, about the fact that Massachusetts has one of the most tight eligibility of most states in the United States. So this is incredibly important for folks that might not be carved out on a particular DDS waiver. At the bottom in the orange yellow box, that will take you to our MDDC fact sheet regarding the bill to adopt the federal definition H276, Senate Bill 150. So if you want more information on it, that would be a good resource to check out. Oh, Liz.
I was just going to ask if somebody can explain what the Rules Committee is, because I know we hear a lot of our bills are in like House Ways and Means, which is like the Money Committee and the Healthcare Financing, but.
Good question. Rick, do you want to take that one?
Or I can look it up if it's a trick question.
He's just muted.
Part of what I was flagging here is the need to find why these bills were sent to the Rules Committee, because bills can be sent to the Rules Committee for different kinds of reasons. Sometimes they're sent right before a bill is going to be passed, but sometimes they're sent for other reasons, or they're sent there as kind of a way station on their way to another committee. So why these bills were sent to Rules, I don't know. And I think we need some help to try to get to the bottom of that. So,
and what would be the core mission of a Rules Committee? Is that bills that would change laws or regulations? Bills that would do that, they would be considered in that committee, typically?
No, not necessarily. I think it has to do more, I think it's more of a procedural, because all bills that can change laws and rules and, can be in any committee. So I think it's more of a procedural role within the legislature, but it's one that I think can vary um, uh, depending on the context. So I'm trying to get a handle on why these bills are in the Rules Committee. So I think we need more information to figure that out.
For sure. And
Sorry,
I will say,
yeah.
Oh, no, that's okay. We've had direct contact with fetal alcohol spectrum disorder, the executive director and that particular entity, and they've been very much in support of this. There are so many children who experience FASD who have some same functional needs as some kids with autism or other developmental disabilities. And what I've heard from that organization is that oftentimes they're some of the folks that fall through the cracks. And it looks like Barbara has her hand up.
Yeah, I just wanted to say that oftentimes when it goes to rules, what Rules Committee is looking for is a specific letter from the person who filed the bill to ask that it be released and moved on to the next committee.
Thank you, Barbara.
Mhm.
All right, next slide. All set, Rick?
Yeah, next slide.
All right, well, Destiny wears multiple hats. While she has now stepped into the role as policy coordinator for the MDDC, Destiny will continue in her role at DPC. And so now she's switching her hats, and she's going to give us some more details and a more in-depth highlight about the wheelchair repair bill. One particular piece of legislation she's done some very impressive education and advocacy on.
Thank you, Jennifer, for the warm introduction. Yes, so my language is going to be DPC focused in my talk here versus MDDC focused. So the first bill that we're going to talk a little bit about for the wheelchair repair is the House version of the bill. It was prior known as H1278, and now it's H4358. Can go to the next slide. So the main differences that really happened when we changed from H1278 to 4358 was a broader definition of wheelchair. We also, fixed a couple tweaks on like manufacturer versus provider, just strengthened those a little bit, but overall, no major changes that the public would necessarily notice. We had a very early hearing on both of the bills this session, which was great. And we directly bypassed healthcare financing this year, which is historically where this section of the bill went. So as of August 2025, we went to House Ways and Means. In January of this year, we did manage to secure a meeting with the House Ways and Means chair, or the chairman's chief of staff and legal counsel, which we were able to lay a really solid foundation on the bill. And our leadership is in Repo Day, and he was since able to also meet. At that point, we had a little bit of quiet, not as much, direct advocacy, but some behind the scenes stuff happening. And we decided to file the language of the bill as an outside section. What an outside section is essentially the language of the bill, giving a chance to be heard as in another capacity in a section to the budget itself that was known as Amendment 803. We were really impressed. I have a typo here. It should have been 40% of the House signing on to co-sponsor. As much as I'd love to say it was 60%, they had over 60 co-sponsors, which was 40% of the House, which was huge. The fact that we were able to get solid support of that was a really big win, but ultimately the language was not included. Repo Day and I've had a meeting since then, loosely, where he just said it's very uncommon to have an outside section adopted into the House budget, and so there was nothing, sour behind the scenes that happened there. It was just unlikely. And we knew at the time when we did that it was kind of a low shot, but it did give an opportunity for the full House to be able to discuss the legislation. So our next steps include utilizing press and media coverage to provide some outside pressure or education information. And most recently, you'll have seen we had two op-ed or one op-ed in the Globe and then a follow-up letter to the editor just last week. Today, there's an article from the Providers Council. We've got quite a few different avenues of press, releasing into May into June. We're hoping to have an additional meeting in late June at the very least with the leadership staff again to be able to provide, some updates with some records, private records request from our public records request from Mass Health and data over there. So hopefully that will be happening towards late June. And we have begun to talk about an advocacy day at the State House. This is very common. This session, we've been trying to go out pretty much every 2 to 3 months, just to make sure that there is always a bug in the legislators' ears about what's happening with with these bills. So those are in the plans to happen sometime before the final deadline, which is July 31st. We're just trying to figure out strategically when that best time would be used. Next slide. So now we're going to switch gears slightly into the Senate version of this bill, and they differ slightly. We can go into the next slide. So the Senate version of the bill was actually completely different to the House bill when it first went out. It was originally filed as S-210 and was the bill that most people are the most familiar with. It was very technical in wheelchair warranty and lemon law. And it's had a history of passing in the Senate twice. As I mentioned, we had an early hearing back in April of last year, and in October, the Consumer Protection and Professional Licensure Committee had asked us to review the bill. They essentially asked us, what's our dream version of the bill? And then talking with community members and the coalition, Rick so kindly helped us draft what is now known as S-2662, which is essentially the same as the House version of the bill, which not only defines but enforces a repair timeline of 10 business days, but it includes 2 extra provisions or 2 extra lines requiring the offer of a loaner chair, and it extends that warranty to 2 years. When we were talking to community members, we learned that what they valued the most of the Senate bill was the requirement of a loaner chair and a larger warranty time. So we made sure to incorporate that. That then switched over into Senate Ways and Means. Again, we bypassed healthcare financing, which at the time we're like, this is great news. But as we know, things can get caught up in Ways and Means as well. So our next steps for the Senate is we have a meeting with the Vice Chair, which is Senator Comerford, this coming Friday. And again, we feel reasonably confident on the Senate's ability to get this passed, as they have passed it twice before. But what's important to note here is this is a different bill now than what they were familiar with. So it's important to educate what this language is. And also there have been some rumblings about the Senate getting slightly tired of passing a bill and waiting for their colleagues on the House to act as well. So we're on our ends making sure to meet where these mumblings have been happening to make sure that we can, really address the root cause of that and kind of explain any concerns that we have. So hopefully we'll continue to see movement on the Senate side and be able to, fully focus on the House, which is where our biggest cause for concern is right now. And we can go to the next slide, which are just some pictures here of our recent articles in the Globe and some of our members from Unstuck and the Coalition and another wheelchair user who frequently join me at the State House for lit drops. What's cut off on my screen is the QR code on the left-hand side. I'm not sure if it's cut off on other people's, but that is a chance to make sure that you're signed up and connected to our campaign email, which is where we send, the calls to action for DPC or the notices where it might need a quick response or time-sensitive items. So if you can't see that QR code, I can verbally say that the link for Caitlin perhaps to put in the chat is tinyurl.com/joindpc-DME. So that's be able to sign up for that campaign, and I can put that in the chat too.
And it should be viewable. We'll be posting a copy of the slide deck online, and I know Caitlin will drop a link to the webpage, MDDC webpage, where we include those, and a recording of today's meeting.
Thanks, Jennifer. And that's it for me.
Thanks, Destiny. Okay, now state budget update. I'll pass it on to Jennifer.
All right, it's 3:34, so I'm gonna move swiftly here. You're probably familiar with this graphic. It basically takes you on a timeline of the state budget and where it goes and what month with the development of our state budget. It's May, so the Senate has been working hard here on bringing something together. The box at the bottom center, if you click there, you can learn more about the state budget process. But essentially, you can see like it begins in January with the governor's budget, and the House, in April, the House is working on it. May, generally, the Senate works on it. By June, we have a community of conference if things go along the way that we would like. And then by July, first, we have a final budget. So, all right, so let's talk a little bit more. Right now, if you were to go on the general court website in Massachusetts, you would see this graphic right here, that it's currently in Senate debate. So what does this mean? What is this step? Well, the Senate considers amendments to the Senate Ways and Means budget recommendations. And once you have the slide deck, if you click here, you can see all of that. And they debate their inclusion in the bill. It's very busy time in the Senate, and maybe that's why things aren't moving quickly out of Ways and Means, because the budget is such an important part of the year-to-year process. But they're constantly working to make sure that they're listening to constituents and meeting the needs that they have, and that they're going to be addressed and represented in whatever that final budget looks like. So if you're looking for more information, this is a valuable link right here. So Senate Ways and Means Committee released a fiscal year 27 state budget proposal. Here are just some highlights from that. It contains provisions that include, oh, and by the way, all of this information was based on a more in-depth analysis that the ARC of Massachusetts has released, and they also have it on their website if you want the full analysis and all of the data and information they included with it. If you go to the box in the bottom center, you will be able to find the full analysis. But we're just going to hit some high-level things for the purposes of our meeting today. So the Senate Ways and Means fiscal year 27 budget contains provisions that have stronger language around Chapter 257, reference to the AFC working group, and also key language for our Turning 22 bill. So I know we were just talking about that a little earlier. So it's interesting, I think, that there's some key language for the Turning 22 bill in the Senate Ways and Means Committee proposal. Budget proposals, they're complex. I'm sure you can imagine, for those of you who have seen these, I mean, it's very hard to piece out and digest. There's so much detail, but the language in these proposals are really important because they can ensure that certain things happen. The Senate Ways and Means commits the same amount of funding for Chapter 257 services as the governors did. I believe that's about $175 million in funding. And that was also the same for the House proposal. So there's some consistency across the board, from the governor's budget to the House budget to this Senate Ways and Means Committee proposal. What are we doing? We're going to continue to collect and share stories from our community with state leaders and lawmakers. If for number one, if you go to this link, you could still share your story about why Medicaid matters to you, your developmental disability services, your PCA services. those are all Medicaid services. And, we would be happy to share your stories. If you do submit a story, we could reach out and maybe entertain the opportunity to meet with your lawmaker. We'd be happy to support you in doing that to help make sure that they're aware of the voices and the needs of their constituents. Disability policy resources like the ones that you see on our website. We have a variety of resources related to Medicaid and Medicaid funded long-term supports and services, LTSS, and of course, home and community-based services, often referred to as HCBS, lots of acronyms, and workforce rates. So we'll continue to distribute those. And then what else? Well, you can meet and collaborate, and we will continue to meet and collaborate with state leaders, administrators, legislators to help ensure that these stories are heard and they understand the importance of eligibility to services. So you, again, if you're not sure who your legislator is, that's okay. Every day is a new opportunity. At the link under number 1, find my legislator. If you enter in your address, it will tell you who your state rep is and who your state representative is. You can contact them. Remember, they work for you. And their job is to represent their constituents' interest. They need to know what you know in the small part of humanity in order to make responsible policy and program decisions. Because unless your life has been touched by a disability, you're not necessarily going to know. And lawmakers don't know everything about everything. I mean, how many bills were filed this year? Was it somewhere between 7,000 and 10,000 bills? I thought we broke a record. Maybe it was last year we broke the record, but it's a lot of bills. They can't possibly know everything they need to know. That's where you come in. So you can contact them. You can visit them in district. You could schedule a meeting in district or at the State House. We'd be happy to help set that up for you. You can share your story and explain how the state budget or certain pieces of legislations would impact you and your family. So we're here to help. Destiny, I added your name here. And but we, among all of us working together to support our policy activities, there are multiple people. We work together to help members of our community.
Okay. Now, for coalition updates. So, yeah, let's go to coalition updates. Next slide. So, the PCA program. So that's Tamara. You're on, Tamara.
Hi, my name is Tamara, and I am here to talk to you about the PCA update and the highlights from our last meeting in April. And some of the changes include the new meal preparation. A new cap on meal prep hours has been set to no more than 7 hours per week, unless the consumer employer submits documentation showing a medical necessity. Oh, sorry. And then also there's an adjusted cap on the work hours. A firm limit has been set. A PCA cannot work more than 60 hours per week total across all jobs and consumers. And then the new hire work process, consumers must submit all hiring forms, including I-9, which will be verified by E-Verify. This will tack on time, which will prolong the PCAs to be able to work for the consumer employer. So it's just going to extend the time. So, and next slide. We also had a demonstration put on by the Department of the Disabled Persons Protection Commission and AGE about recognizing and responding to reporting abuse. And I itemized what I thought was important. The DPPC, the Disabled Persons Protection Commission, helps adults ages 18 to 59 and a person with a disability and alleged harm from partially or fully dependent on another person for care, either paid or unpaid. And then PCAs working for agencies that are state funded programs are considered mandated reporters based on their role for the DPPC. Now, what's interesting for aging and independence is they work with individuals 60 plus living in the community and alleged harm by an individual, and it excludes cases involving medical licensed facilities. On underage ages regulations, they are PCAs are not considered mandated reporters. Next slide. And here are some resources I put together for you to have on hand. It starts with the Mass Health list of public hearings. This is where the PCA public hearings are posted. And should you need help with the appeals testimony, please contact your personal care management team, which is also your skills trainer. Typically, it's an independent living center, and they can help you with your appeals process. And I also highlighted the Disabled Persons Protection Commission and the H hotline for your reference. And here, as always, the PCA council meetings, they're always open to the public, and the link to the schedule is listed. And you can always feel free to reach out to me if you have any questions or need further help. And I just wanted to let you know our next PCA Workforce Council meeting is June 9th from 1:30 to 3:30. So, does anyone have any questions?
We should probably do questions maybe when we get to public comment. But thanks, Tamara, for your report. Let's go to the next slide. Rev up. I think that's Brianna.
Hello. I'm not sure if I'm able to share a screen or not. I can always put my slides in the chat or send them later.
Why don't I make you a co-host? You should
Okay.
be able to share. Okay, give it a try.
Yeah, you're going to have to stop sharing
Yeah,
though.
I'll stop sharing.
Oh, yep.
Oh.
All right. Sorry, I can never find the slideshow button when I need to. So hi
We're so
everyone.
grateful, by the way, for you coming today and taking the time.
Of course, happy to be here. Hi everyone, I'm Brianna Zimmerman for anyone who doesn't know me. I know a bunch of you. I'm the voting rights advocate at the Disability Law Center. And I also help to coordinate Rev Up Massachusetts. And MDDC is an important, super helpful member of Rev Up. And so I was asked to provide an update on the decision, the recent Supreme Court of the United States decision, Louisiana versus Callis. I'm hoping I'm saying that right. So just for some background first, the Voting Rights Act of 1965 is a really important civil rights law. It guarantees that the right to vote won't be denied due to race. As many of us have learned, hopefully in history classes, people of color, especially Black voters, were either denied the right to vote or there were several, policies that made it very difficult for them to vote after the Civil War and during the Jim Crow era. So the Voting Rights Act basically says that people can sue if there are any laws or procedures that deny equal voting opportunity to and based on race. And so, for example, there used to be poll taxes and literacy tests. And of course, we know literacy tests also have a disability impact as well, and poll taxes as well have an impact on people with disabilities, particularly people of color with disabilities. So making it so that you have to buy an ID, a special kind of ID, or making it so that you have to pass a sort of test is discrimination. And we know that maps can be drawn in a way to underrepresent Black voters and other voters of color. And so this case basically came after a bunch of, just like any Supreme Court case, came after a bunch of sort of arguments and decisions on the district court and federal court levels. And I'm sure Rick could probably explain it a lot better than I can, but just the basics are that after the 2020 census, and censuses are very important for seeing who lives in certain communities and how they're being represented in Congress, or even in the state legislature as well. And so after the 2020 census, there was the redrawing of maps. Massachusetts also had a redrawing of maps in 2021, and voters said that the map violated Section 2 of the Voting Rights Act because it underrepresented Black voters in central Louisiana. And so they asked for a redrawing of the maps. The maps were redrawn, and white voters then challenged the redrawn maps. And so this went all the way up to the Supreme Court, and I'll tell you basically what the impacts are and what the decision was on the Supreme Court level. And so the Supreme Court ruled 6-3 that the two majority Black districts were unconstitutional and were a racial gerrymander. The Supreme Court allowed Louisiana to draw a new map in time for the 2026 elections, and that new map is expected to favor Republicans and underrepresent Black voters. And so it takes away, some of the power of voters in those communities. And also it weakens Section 2 by placing burden on plaintiffs to prove intentional discrimination, rather than just discriminatory policies with discriminatory results, which, as we know, as many of you might know, it's really difficult kind of to prove intentional discrimination. There's a big quote from the Legal Defense Fund that I thought was like worth reading through yourself, maybe. But basically, they say voters of color have never been given anything, and they've especially never been handed a representative who fights for their interests and needs. And they basically say, we're just going to continue to fight. We'll continue to fight in the courts, the state house, the streets, and most importantly, at the ballot box. I've also included a picture from the American Association of People with Disabilities. There's a woman named Justina Plowden, who is a Rev Up organizer from Louisiana, and she's featured. She's in a wheelchair, and she's a Black woman. And she says, when the Voting Rights Act is weakened, it is not an abstract policy shift. It is a direct hit to Black voters, brown voters, disabled voters, rural voters, and every community that has fought for generations just to be seen, counted, and heard. And on a more positive note, we have the Rev Up, the vote webinar happening on Thursday, May 14th. And so part of what AAPD is suggesting that people do is to get involved in Rev Up coalitions. And so you can get involved in the Rev Up Massachusetts coalition. This will be a webinar, but you can also sign up for our email lists and get involved in more meetings in the future. We'll basically be focusing on the rights of voters with disabilities, how to register to vote, ways to vote accessibly, and how you can get involved in the Rev Up Coalition. There's another slide on that, but I'll skip that. And I've also included a bunch of links to the court case, Louisiana versus Callis. And I needed to like look up this case and research it a lot. And like I said, I think it's a lot to go through, to parse through, but the basic outcome is that unfortunately it does weaken the Voting Rights Act, and we need to do a lot on the state and federal level to fight against that. So I know some states are actually passing their own state level Voting Rights Acts. And so, maybe that's something that Massachusetts will consider. We will have to see. I'll stop sharing and I'll share the link to the presentation in the chat as well.
Thanks, Brianna.
Okay, back to the slideshow. Okay, so now we're going to talk about Guardianship Alternatives Innovation Network. I think that's you, Jennifer.
Yeah, just quick brief overview here. It's 3:55. We're definitely going to go over a few minutes. Thank you for your patience, everyone. But MDDC has been leading the GAIN coalition, and the focus is around guardianship alternatives. Years ago, it started as the Guardianship Working Group. And that initially came out of a Crocker Fellowship because of guardianship issues that were happening and of concern here in Massachusetts. In 2024, members decided to really focus in on 3 primary areas around data, training, and the least restrictive framework. And today, my colleague Lee LaRue has been working with a work group within GAIN on an upcoming panel and training. So I'm going to hand it off to her.
Great, thanks, Jennifer.
Do you want this slide first? Yeah.
Yeah, so the title of the panel that's going to be taking place on May 20th starting at 6 p.m. It'll be running for an hour, and then we'll have a Q&A from 7 to 7:30. Is called Unraveling the Mysteries of Guardianship Alternatives. And this is really a community conversation with people who live it. So the main focus is going to be individuals that all have a different support system, whether it be a full guardian, a partial guardian, a youth-supported decision-making, combination of both. And we will have additional experts that will be just, demystifying how to use and how these alternatives can be used. So we're looking for anybody and anyone who's interested to join us. I will put the link in the chat. Registrations are still open. And I can just give you a little outline. If we can go to the next slide, please. So we'll do a panel introduction from 6 to 7, introduce the key terms. Again, panelists will be sharing their lived experiences using guardianship, all different alternatives to guardianship. I need to update that. We have Beth Collette, Craig Kinney, Sandy Heller, Desiree Perez Batista, Sam Pastor, and then we also have Betsy Johnson is going to be joining us, as well as Morgan Whitlatch, who is a lawyer for the Center for Public Representation. So again, I will drop the link in the chat and hope that you can join us or share it with others who you think could benefit from this topic discussion. Thank you.
All right, so federal update. Back to you, Jennifer.
All right. Whoops. things moving along here. Very high level. While we've been working on our state budget process, lots has been happening on the federal level with their appropriations. I have some plain language definitions to some of these terms in the left-hand slide, and I want to give a big shout out to the AUCD Disability Policy News. That's a link if you're interested in getting some policy news about what's happening on the federal level. This is a great resource because they include a plain language version in their update that's easy to understand. And I prefer it. Sometimes I understand more by reading their update than some of the other things that I track and follow. So what is appropriations? It means money that is set aside by Congress for a specific purpose. So right now, the Senate Judiciary Committee released a budget proposal. You remember last month we talked about how the president had issued his budget proposal. We went over last meeting, some of the priorities in his budget and some of the things that he was proposing to cut in the budget. Now, the Senate Judiciary Committee released their budget proposal in what they call a budget reconciliation bill. You can see it by going to this link right here. Well, what's a reconciliation bill? It's a bill that changes laws about taxes and about how the government spends money. And these changes are made to match the goals of the administration of the federal budget, match the goals of the federal budget. Well, and of course, what the administration is interested in doing. So what was in this budget proposal from the Senate Judiciary Committee? There's a lot in there. Let's just touch on two things. There's some immigration enforcement agencies in the Department of Homeland Security, so funding for that, Secret Service upgrades related to the president's White House ballroom project. Congress is also talking about a third reconciliation bill that would invest a lot of money into the military. So to summarize, Congress uses these reconciliation bills because they can make big budget related changes really quickly, really fast. And they don't need to have as many people to vote yes on them. So they don't have to have a majority of their party to be able to change them. And therefore, they're able to be passed more quickly than under like the normal rules. So for more information about these highlights, you can definitely go to this link. There's also a sign up if you want to receive that newsletter. Let's talk a little bit more about this. So what is Congress doing right now? Well, they're drafting bills that will include appropriations for different federal government departments and programs. They're going to hold budget hearings. They've already started to do this, where they meet with agency leaders who talk about the president's budget proposal. And they're going to do this thing where they call the hold their markup. What does that mean? If you look over here on the left, markups, it's like a legislative workshop. They meet as a, Congress meeting of a congressional committee where lawmakers go through line by line of the bill and they decide what changes they want to make, and they can add or remove or rewrite parts of the bill. The goal is to shape the bill into a final version that the whole chamber can debate and then vote on. So they've been very busy, and the federal budget has been something of a priority and a focus as well on the federal level. The Centers for Medicare and Medicaid Services. Now I want to talk about some federal Medicaid data. And this was also included in the AUCD Disability Policy News update. Well, anyways, this CMS, Centers for Medicare and Medicaid Services, they have data that shows that Medicaid enrollment has dropped by 3.4 million people. And this was just between January 2025 and January 2026. Most of the eligibility and enrollment changes from H.R. 1 haven't even taken effect. Right now, states are grappling with having to implement that law from last July. Remember, it passed on July 4th. In a Congressional Budget Office report, sometimes you'll hear about them referred, and we refer to them as CBO. They estimate that 10 million more people will be dropped from Medicaid and the Affordable Care Act coverage by 2034 due to the policies that are in that HR 1. Remember, HR 1 has a lot of different names. It's One Big Beautiful Bill Act. Some people call it OBA. Some will refer to it as OB3. So a lot of people stand to lose their eligibility from Medicaid. We know that states are going to receive a huge reduction in funding for Medicaid in their states. So states are working hard to be able to comply with the law. And the initial data that we're seeing here shows what we expected to happen even before it was passed and people were debating HR 1 as a policy. So go to AUCD Disability Policy News for more information. Now, Barbara, I know we had sort of talked back and forth, and I don't know, Ann Lynch is still on the call as well. I wanted to bring back Texas v. Kennedy. Remember this lawsuit? It was originally about gender dysmorphia. Well, then it shifted where the right to live in the community, the integration mandate was being challenged. Well, the state of Indiana has withdrawn from that lawsuit. I don't know a lot about this, and I'm not an attorney, so if there's anyone here, Barbara or Ann, if you want to add to this.
Hi, Jennifer. This is Ann Lynch at the Attorney General's office. I think Barbara has hopped off the call.
Okay.
I think she had to go at 4.
Yeah.
I'm not sure what you're looking for, but I can quickly share that the remaining plaintiffs, which I think we're down to 8 states, including states like Texas and Alaska, have reinvigorated what's left of the case, which is, and they have amended their complaint to focus solely on the community integration aspects of the regulation that they're challenging. And they have filed what's called a motion for summary judgment. That just happened last week. The federal government is going to respond to that. There will be a hearing, and then the trial court in the Fifth Circuit will make a decision. All of their current claims, the plaintiff's current claims, are claims relating to what is called the Administrative Procedures Act. So these claims would potentially invalidate the regulation requiring community integration, but would not declare Section 504 unlawful or unconstitutional in and of itself. I'm happy to answer questions if I know the answer. If you have questions, I think that's a quick summary.
I guess,
That's a
Anne,
very
this is
specific.
Jossie. One thing I'm curious about. What?
No, go ahead.
Oh, I was just going to say that the Attorney General of Indiana, the reason why he dropped out of the suit is because he said that the gender dysphoria designation had been taken care of by the Trump administration. But what I'm curious about is that was done in January, so why didn't he drop the suit in January? I mean, what was there another reason why he dropped it that he's just not saying? Like maybe there was advocacy, for instance, and he's just saying it's because of gender dysphoria, or I'm just curious about that. Why he dropped it now when the reason he's saying he dropped it happened in January.
Jesse, this is Anne. I actually don't know the answer to that. The Indiana AG is a mystery to me. I will say you're absolutely right. The gender dysphoria aspects of the regulation were removed in December. The complaint was amended in January, as you say. I believe it was January. And Indiana was on that amended complaint. So I don't know what happened. I think there's been really good advocacy in the states that remain on the case or in the states that originally filed the case. Really good public advocacy and outreach to leaders in those states that convinced a ton of states to hop off when they had an off ramp. So I don't know that that's the reason, but I think that there's been a lot of really coordinated vocal advocacy. Um, and so if you don't like this case and you know people in those 8 states, uh, you might know what to do.
Thank you. Thanks.
Excellent. In the interest of time, I'm going to go ahead and move on.
Okay, so now we're going to go through some council and community events. So let's go to the next slide.
So, oh, I think this one's mine.
Okay.
Oh, actually, Jossie, you were there too, and you're actually in one of the pictures. Do you want to speak to this one?
Yes, actually, the Secretary of Administration on Disabilities, which is part of the Administration on Community Living, which is part of the the Department of Health and Human Services, Rebecca Hines. She came to Boston on a listening session to basically get an on-the-ground analysis of what's happening, and
Yeah, it was exciting that we were able to take a few minutes and Jossie had an opportunity to introduce himself. We understand that her family has been touched by disability. She had, I think it was a nephew who had a disability and after high school worked for, I don't know, 15 years to try to access HCBS services. He's passed away, I believe. And she experienced a lot of, frustration and challenge, and heard about it on a first basis from, members of her own family. So we're happy to at least make the introduction. And there were many members from the independent living centers there. Emily Lauer was there from the USED, and thank you to Hillary from the DLC was there, shared some important information about the DD network and the needs of the IDD community. How do you pronounce this? Caitlin, is it Neidler grant? There was a couple of people that touched on the importance of those grants and the important work that comes out of that and why they are of value. So yeah, we're hoping she expressed an interest to keep an open line of communication and we'll continue to do that. And yeah, the woman to her right in the very right-hand corner, her name was Ophelia, but I did not get her last name. So sorry about that. But this is Commissioner Rebecca Hines right here. And she is the commissioner of the Administration on Disabilities. Or is it disability?
What I would say about Rebecca Hines is she's in a very interesting position. She seems to be personally in support of HCBS, probably because of her personal experience, but she's working for an administration that's against it. And there was that tension even when she was talking, where it was like she was like trying to like thread a needle a little bit. So she's a person who I guess is a good person to advocate for, like in essence, like the attorney generals, you can advocate and see what you get because she is sort of somewhat in our corner, even though she's not. She's conflicted, I would say.
Well, yeah, and I don't know if the administration necessarily would be saying something like we're against HCBS. Obviously, their decision to reduce funding for Medicaid and these changes in HR 1 have unintended or so consequences. But we're happy that we had an opportunity to make that contact. We'll try to maintain that line of communication and continue to express the importance of Medicaid, home, and community-based services and how cost-effective they are. Because one thing that they did emphasize is the importance of cost-effectiveness and affordability. So we were able to share some tidbits and information about how HCBS services help people thrive in their communities, and how many more people can be served rather than being institutionalized or being housed in like a nursing home. So we'll see what happens. Caitlin, were you going to add?
When I said that the administration is against it, I was referring to what both RFK Jr. and Mahmoud Oz said about home care being what the family should do. In other
I
words, the
see.
government shouldn't be paying for it. This is what families should be doing. Does
Okay.
that's what I was, so.
Okay. Thank you
But you're
for,
right. But we'll see what happens.
yeah. Caitlin, did you want to add something?
No, it's okay.
All right. Um, just recently, I think was it last Friday? I don't know. The days are kind of blurring together. The statewide family leadership series had their culminating session where they all come together from different regions and they visit the state house. They have a tour, and then there's a little luncheon. And we had Senator Moore who came to speak to the members of the family leadership series. I was also there this year. MDDC provided some targeted training and guidance and consultation on supporting the advocacy and empowering family leadership members to be able to build relationships, understand more about the legislative process, what to expect at hearings and testimony, and so forth. And then you'll also see Commissioner Sarah Peterson pictured in the upper left-hand corner. She came and she also connected participants and also shared some remarks.
Jennifer, I just wanted to say really quickly, I was also a part of the family leadership series.
Oh yeah?
So, yeah, me, me and Tatiana was also a part of it, just to add a different perspective to, and to add our voices in the midst of the community.
Excellent. Now,
So,
were you with one of the other regions? Do you know which regional family series, leadership series that you went and presented at?
um, I'm not sure, but I know it was from February to March, or February to or mid-April, and it
Okay.
just wrapped up.
Okay. Well, I'm so pleased to hear that you were able to go and speak to families. Parents need to know and they need to hear what you and Tatiana have to say. So thank you for your leadership and
Yeah.
Yeah, thank you.
what you had
And
to offer them.
and and while I have my mic open, when we were at me and Liz were at the State House for Developmental Disability Awareness Month,
Yep.
doing that, um, handing out the packages. I guess you would say, like, Senator Wellesley really was invested, and and I could tell that she she really was committed to her mission. Like, it's one it's one thing to say that you're committed, but to actually be committed is another thing. So, and Senator Lovejoy was committed. So that was really moving to see that she would take valuable time out of her day for us. So that was really moving because you often don't see that in leadership roles.
Wow. Thank you for sharing that. And I was thinking as you were sharing, yeah, we need to see action. It's one thing to say, yeah, we're committed, but we need to see the action behind that to back it up, to know that that
Yes.
commitment really exists.
And
Thank you,
and
Austin.
I think in this community we 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 lead with that example. And welcome Destiny to our team. I'm so thrilled to hear that you'll be a part of our team. Your your ton your contributions will only make this team a stronger asset. Asset. All right. Thank you, everyone.
Thanks.
That's all I have.
A couple Fridays ago, we also had, there was Independent Living Day hosted by the Independent Living Centers, some very passionate speakers. If you go on if you go on our Facebook social media, there's a post about this, and there's some video clips of Senator Kennedy speaking very passionately about the importance of affordable and accessible housing. And right here in this picture, you see Representative Mindy Dahm, again, some very passionate comments and a stated public commitment of housing for people with disabilities. As you know, a couple years ago, Senator Robin Kennedy was recognized as one of our champions. So here are a variety of pictures here with members of the community and some Spooner graduates. We see Desi here and Benji here. He has really been a powerhouse on all things disability. That segues into the fact that the qualified allocation plan that we talked about at the last meeting, well, there's going to be a QAP housing celebration. There was an amendment that was included in Massachusetts QAP, and it's really profound what it will do. The amendment will create significantly more affordable, accessible units by making the low-income housing tax credits the program that funds the most amount of affordable housing in the country, and build state-funded housing to build 10% of affordable housing. I'm sorry, I'm having a hard time here. To build 10% of affordable units as accessible. And that's in cases where the project has 10 or more units and an elevator. It's expected that most projects will meet these thresholds. So this is a significant step forward over the 5% accessible units for projects over 20 units required by the Americans with Disabilities Act. So there's a celebration being planned. It will happen on May 21st at 1 p.m. It's happening at the Worcester Public Library in the Sachs Room. I think that's how you pronounce it. And so information is there. If you have more questions, please feel free to reach out. And I'm going to hand it over to Liz. We are well over the meeting. We'll do better next time to gear the time we have available.
All right. I think most people in this meeting know about our state plan. It's been out. We've been sending email. We've been sending social media posts, but we really want to give a push for our community to fill out this survey, but most especially people with developmental disabilities. Their proportion of filling out the survey is not as high. So we're going to ask everybody who hasn't filled out our survey to fill it out. And please, if you know people with developmental disabilities, Caitlin and I are willing to, work one-on-one with people to get the surveys completed and to help out in any way that we can. That's the short version. Next slide. So if you've seen the survey, you will see we have 4 goals that we had identified through previous work that we've shared in this meeting. But we're asking everybody to weigh in on these goals, what's important to them, and some other questions related to these goals. Disability, identity, community, and leadership, health and well-being, community living, participation and inclusion, and thriving across the lifespan. Next slide. And then we're going to be meeting with our state plan committee next week to fine tune some of these goals and objectives, meet with our council second week in June to try to finalize them. And then we put it out for community input for a 45-day period. And then our deadline to submit our state plan with a lot of other information is on August 15th. Any questions? Let me know.
Thanks, Liz, so much for doing the overview. I'm going to chime in just for 1 second to say we've only had 46 people with intellectual and/or developmental disabilities take our survey out of over 300. And we'd really, really love to see that number increase. So just highlighting and underscoring Liz's request that if you know folks with developmental disabilities, to please share this with them directly, and please share both me and Liz's contact information. I'll put it in the chat. And we are so happy to have a Zoom call or meet someone in person and sit with them and go through the survey together to try and lessen some of the load of having to read through lots of text and things like that. So please, 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 and thank you, thank you, thank you.
Okay, partner updates. I know we have at least one partner here from ICI. I don't know if any other partners are here, but any partner updates?
So this is David Hoff from ICI. I'll make it quick. So a couple of quick updates. We are working on an application with the Disability Policy Consortium to educate individuals on the impact of the H1 Big Beautiful Bill, whatever you want to call it. And so that we're putting that in. It's for the Robert Wood Johnson Foundation letter of intent going in this week, and we will know whether we're going to submit a full application in late June. So it's early in that, but it's an interesting and definitely a much needed effort in terms of making sure that people understand the impact. I mean, the discussion earlier about the impact on Medicaid, it's actually really scary what's happening with Medicaid. And so people need to be armed with information and understand what's going on and also be able to advocate. So we're working on that. The other thing is as many of you might know, Cindy Thomas retired as a director almost a year ago. We've had an interim director since November, but we expect an announcement about a new director within the next week or two. So stay tuned on that. And that is pretty much what I've got today.
Okay, any other partners here? I know Ann Lynch had to drop off and so did Barbara. I don't know if anyone else. No, okay. All right, so I guess in the interest of time, we should probably move on. So here's a meeting poll for you guys to fill out.
Little bit of a typo there in the bottom right-hand corner. Sorry about that, folks.
That's right. So next slide. All right, so public comment. Anyone from the public?
I think we lost folks.
Okay, all right, so I guess
We'll do
we'll
better about managing our time and the content for next time. We'll work on that.
okay, so I guess we'll move to the next slide then. Okay, we have 3 meeting dates for the rest of the year. August 11th, October 13th, and November 17th. And I say this meeting is adjourned. I'll give you some of your life back, your time back.
Oh,
Thanks,
we've already
Jesse.
taken. Let me stop the recording.